Hi, good afternoon. My name is Aaron. I'll be your nurse today for your physical exam. How are you?
Good.
Good. So I'm just going to check your patient band real quick to make sure you're the right person. I see you've already donned your gown that I asked you to put on. Thanks a lot. So I'm just going to start with the systematic head-to-toe exam on you. If you have any questions during the exam, you don't understand anything that I'm doing, please ask. I'm going to give you some instructions throughout. It sounds a little strange. If you don't understand something I ask you, just please ask me, okay? And if there's anything you feel uncomfortable about during the exam, please let me know as well, all right? So we're going to start with the head and face. So I'm looking at skin characteristics to make sure that everything is symmetrical, that everything matches. I'm looking for rashes, any blemishes, any abnormalities. Looking at hair distribution to make sure that everything's equal. There's a normal hair pattern. So looking in the back as well. I'm looking at your eyes and ears to make sure everything's symmetrical and normal. Any abnormalities. And then I'm going to go into palpation. So I'm going to palpate the skull. Frontal sinuses, your maxillary sinuses. Any pain there? No? Open and close your jaw for me. No? Yeah. Any pain there?
No.
No? Alright, so I'm going to have you do a couple things, okay? It's going to sound kind of funny, but I need you to squint your eyes like this for me. Okay. Puff out your cheeks. Like this. There you go. Can you open and close your mouth? Yeah. Alright, thank you. Let's see what else we... Can you wrinkle your forehead? Kind of like this up and down? There you go. Like this. There you go. Where did the sinuses? So now I'm going to do light touch. So just tell me if you can feel it. Close your eyes. Can you feel this?
Yes.
This?
Yes.
And that?
Yes.
Okay, thanks a lot. Now I'm going to inspect your eyes. So I'm looking at the symmetry of your lids, your lashes, the palpebral folds, just to make sure everything looks symmetrical. I'm inspecting your conjunctiva, the sclera. I'm looking at the lacrimal apparatus, and now I'm going to palpate that. Tell me if you have any pain there.
No.
No? Okay. So I don't have an otoscope, but I'm going to pretend like I do have one. So I'm just going to take a look at your eyes. So I'm going to shine a bright light in. Eyes open, please. I'm going to shine a bright light into your eyes to check your pupil reaction. Okay. Look right at the light, okay? Okay. So I'm going to put that down. Now I want you to follow my finger with your eyes, okay? So look at my finger. Okay. Cover your eye for me. No, just one. Sorry. Just cover your left eye for me. Alright, so now I'm going to come in with the otoscope, check the corneal reflex on the side. Alright, switch eyes. Come on the other side. Okay. Everything's normal there. Let's see if we missed anything there. Alright, so tell me when you can see my fingers. Or actually, how many fingers am I holding up?
One.
How about now?
Two.
Don't look at them. You gotta look straight ahead, okay? Look straight ahead, please. How many fingers am I holding up?
One.
How about now?
Three.
Stop looking at them.
Two.
Okay. Thank you. I'm also looking at eyebrow alignment just to make sure everything's normal and symmetrical. Looks good. Alright, so now we're going to take a look at your ears, okay? So I'm going to move your hair out of the way a little bit so I can see. I'm expecting the ears to make sure they're symmetrical and there's no abnormalities of the tissue. I'm going to palpate the auricle. I'm looking for any abnormalities like cauliflower ear, any masses, anything like that. Everything looks good there. Okay. Alright, so I'm going to test cranial nerve 8, or by doing the Whisper test. So we're doing this. Can you hear that?
Mm-hmm.
What does it sound like?
Air.
Okay. On this side. Can you hear that?
Same thing.
Okay. Alright, so now I'm going to simulate my otoscope exam as well. So I'm going to take a look into pulling up and back, taking a look into the ear canal. I'm expecting the external auditory canal to make sure everything's normal in there. I'm looking at the landmarks, so I'm looking for the tympanic membrane, the auditory ossicles. I'm looking for any inflammation, retraction, any signs of infection, anything like that in the ear. Everything looks good there. And I'm going to do that bilaterally. Alright, so now I'm going to take a look at the nose. Same thing as before, I'm looking for symmetry. Can you put your head back a little bit? I'm looking in the nostrils for any type of deviated septum, Any abnormalities? Everything looks good there. Alright, so your nostrils are nice and patent, so it doesn't look like you have a deviated septum or need occlusion. I would also take the otoscope at this time, have you put your head back a little bit, and do an exam in there. I'm looking for patency. I'm looking for any polyps, any septal deviation, anything abnormal, any blood. Everything looks good in that. We can test cranial nerve 1 if needed. So I basically would have you smell coffee or something strong that you could identify that'd be easy to smell. So we'll just pretend that we're not going to do that one today. And now we're going to take a look at the mouth and the oropharynx. So we start by inspecting the lips, making sure everything looks normal there. Can you open up for me? All right, so now we're going to take a look at the teeth. Keep it open, please. Look at the tongue. Can you stick your tongue out and say ah?
Ah.
So now I'm going to take a look into the pharynx. I'm inspecting the tonsils for any inflammation, any abnormality, any erythema, any exudate. Everything looks normal back there. The tongue looks good. Can you move your tongue side to side for me? While I'm in here, I'm also going to test the gag reflex. So the vagus nerve, I'm not going to do that, I'm just going to simulate it, but I would stick back there. That would test the vagus nerve. I'm going to have you swallow as well. Can you do that for me? Not like dramatic, just swallow normally. There you go. Thanks a lot. Everything looks good in there. The teeth look good, the gums look good, your tongue looks normal. I don't see any abnormalities in the mouth at all. So now we're going to move on to the neck. So we're going to inspect the neck for symmetry. Move your hair a little bit out of the way. So we're making sure everything's symmetrical, there's no abnormalities. I'm looking at the cricothyroid cartilage. I'm looking at the thyroid specifically to see if there's any abnormalities there with the cartilage or the chin itself. I'm looking at the jugular veins to see if I notice any pulsations. Anything abnormal there. I'm going to palpate the jugular veins to see if there's any pulsations, I should say. Can you turn your head that way a little bit for me? Okay. Can you move your chin side to side, like so move it over this way, and then this way? All right, touch your chin to your chest for me. There you go. Head back a little bit. Okay, now I'm going to test muscle strength as well since we're doing this, so push back against my hand. Okay. Push forward against my hand. Not that hard. There you go. Turn to your left. Okay. Turn to your right. All right, so muscle strength's good as well. We're also going to palpate, so we're going to feel all the lymph nodes here. So we're looking at the submental, the submaxillary chain, the anterior cervical chain. We're going to look at the preauricular, postauricular, the deep superficial cervical chain. We're looking for the supraclavicular nodes, the infraclavicular nodes, making sure there's no enlargement or anything abnormal. We're also going to palpate the trachea for any type of deviation or abnormalities there. We're going to palpate the thyroid as we go through. So let's take a look at the thyroid gland. Everything looks normal there. So now abnormalities there. What else are we going to do? So we're going to do the spinal accessory, so cranial nerve 12. So also I'm going to have you shrug your shoulders. Is that for me? Okay. All right. Alright, so now we're going to move on to the upper extremities. So I would pretend like the drape is removed so I can see the arms. So we're going to inspect, you know, we're about to simulate. So I'm going to inspect the shoulders, the arms, the forearms, the hands, the fingers. So we're looking for symmetry here, any abnormalities of the skin, muscle tone, anything that looks different, muscle mass, which looks consistent and symmetrical. We're going to do palpation of everything to make sure the muscles feel normal and there's no abnormalities all the way down. We're going to test our radial and brachial pulses. So the radial pulse is here, testing that. It's good and strong. We sit there and actually take the pulse, but we're not going to do that for time purposes. And then we're going to check the brachial pulse. So over here, and we're going to do that bilaterally to make sure there's no abnormalities and everything's good and strong. We're going to do range of motion now. So we're going to start with the shoulders. So can you extend your arms out like this for me? Okay. Bring them down. Bring them out to the side. Like that. Bring them back. All right. So now I want you to kind of bend your elbow like this and put it behind your head for me. Okay. And then opposite, so behind the back like that. And we would do that on both sides as well. All right. So don't let me. So I want you to kind of take your arms like this. No, like this. So kind of do like one of these guys for me. All right. So push out. No, like this. So kind of push out this way. There you go. I'm going to push in so that you resist, okay? There we go. There you go. Alright, same thing here. So I'm gonna push down. Don't let me. I want you to resist, okay? Got it. There you go. And then here, push. Alright. And we already did the shoulder shrug, so we're good with that one. We're gonna test bicep strength. So I want you to curl. I'm gonna push down, so don't let me. Okay. And same thing. We're gonna do it on bilaterally side, or bilateral. We'll do it on both sides. So now I'm gonna test your wrist strength. It's the same thing. I'm gonna push down, don't let me. Okay. That would be done bilaterally as well. Squeeze my fingers. Okay. Do like this for me. Don't let me break it. Don't let me break it. Don't let me break it. Okay, that's good enough. So that's it for the upper extremities. Now we're going to go into the lungs. So we're going to expect for respirations. So we're going to take a look and make sure that the breathing's symmetrical. Everything looks good. There's no abnormalities. We're going to do the anterior part of the chest, or the posterior part of the chest. So we're going to do tactile ephrematus. So I'm going to put my hands on the base of your scapula here. I want you to say 99 for me.
99.
Louder.
99.
99, like that.
99.
Okay, so tactile ephrematus is normal. So while we're back here, we're going to palpate our scapular nodes, check for scapular function, make sure the shoulder feels normal and symmetrical. We're also going to auscultate the lungs while we're back here. So for time purposes, I'm not going to do the entire lung field, but essentially we have the patient take a deep breath in and out. Okay, other side. And then we work our way all the way down to the different points in the body. We're listening for any adventitious sounds, so any crackles, rills, wheezes, bronchi, anything abnormality, or any abnormalities. We're making sure there's no diminished breath sounds or anything strange. We're also going to percuss for resonance and diaphragmatic excursion. So we should have done that first, but that's okay. So this, I'm going to tap on your. You're just going to feel like a little sound I'm just listening to, okay? So I'm going to work my way down. When we do that on both sides, we're just listening for resonance or hyperresonance, dullness, any abnormalities. We're going to look at costovertebral angle as well while we're back here, as we palpate and percuss all the way down. And there's no abnormalities to the chest wall posteriorly. Lung sounds were good. So now we're going to go to the anterior chest wall and also do the heart. So we're going to start just looking for symmetry, observing respiration, making sure that it's symmetrical, there's no abnormalities in respiration or anything that we can see like a thrill or anything jumping out at us from the heart. So we're inspecting for palpations, respirations. We're looking at the posture to make sure everything is equal and breathing on the same level there. We're looking for any pulsations or heavings, and then we're going to palpate for any thrills. So we'll start high, come down, and we're just feeling around to see if we feel any pulsations, thrills, or heaves. Okay. And then we're going to palpate the atrial impulse. Can you just lift your left breast up for me a little bit? So we're going to come in and palpate. It should be about here, but it's basically the PMI. Okay. And we're going to do tactile ephrematus in the front. So like we did before, can you say 99 for me again?
99.
Okay. And then can you lift your breast up a little bit for me? No, your breast, not your arms. So a little bit here. 99.
99.
Thanks a lot. Everything looks good there. So what else do we need to do? We need to do the axillary lymph nodes. So we're going to look in the armpit and palpate to see if we find any lymphadenopathy in the axilla, and we would do that bilaterally. And then we're going to auscultate the anterior wall as well. So we have the patient, same thing. I'm not going to do everything just for time, but just take a deep breath in and out for me. Okay, and then we would do that bilaterally all the way down, listening to all the different lung fields for any adventitious sounds again. And then we're going to listen to the heart. Okay, so we start on the aortic side, and we go to the pulmonic, and we go to the bicuspid. And lift your breast for me again, please. And then tricuspid. And then turn left, or sorry, turn to your left. And we're going to do it one more time. Okay. Alright, so we have no abnormalities with auscultation on the anterior wall or any cardiac abnormalities. So I didn't hear any murmurs, thrills, heaves, any pulsations, anything strange. We're also going to listen to the abdominal aorta just to see if we hear anything there, but that's part of the abdominal exam as well. Alright, so now we're going to do the breast exam. So there's parts of this where I'd have you lay down, but we're just going to simulate it all for time standing up, okay? So I would have you remove the robe at this time. You're not going to do that, we're just going to simulate it, okay? I'm going to have you in different positions as I examine your breast tissue. So I need you to start by leaning forward, or actually not really leaning forward, just kind of having your arms hanging down loosely at your sides. So I'm inspecting the breast tissue for any abnormalities, any masses, any asymmetrical findings. Everything looks good there. So now I'm going to have you kind of put your arms up like this. You can put them behind your head if it's more comfortable. Same thing, I'm just inspecting for any abnormalities, any asymmetry, anything that looks abnormal, okay? What else do we need to do? Oh, so hands on hips, kind of push as you do it. So same thing, we're going to inspect for any abnormalities, anything weird. Then you're going to have you lean forward at the waist a little bit without the hands like that. Just do your hands normal. There you go. I have you inspect there. Everything looks good. Okay. So now we're going to palpate. We're going to do light, medium, and deep. We start with the light. So we're doing the bimanual using both hands. So we're just going through the breast tissue. I'm obviously not going to do this. We're simulating this part. So we're just feeling for any masses, any abnormalities, and we would do that all the way through both breasts into the armpit. We already looked at your axillary lymph nodes. We're going to do that again. The infraclavicular, supraclavicular, and then the last thing we're going to do is check for nipple inversion. So I basically push your nipple inward to see if it sticks and it returns outward, anything like that. All right, so now we're going to move on to the abdomen. This is another exam that I would have you lay down for, but we're not going to do that for time. I'm just going to have you sit on this thing. So we would inspect the abdomen. We're just looking for any abnormalities, any masses, any nodules, any abnormal characteristics of the skin. And then we go into our auscultation after the inspection. So I'm just going to listen to your abdomen, and I'm just listening to all 4 quadrants for vowel sounds. So we got our right upper here, left upper, left lower, right lower, and we're just listening to vowel sounds to make sure they're present. And there's no abnormalities of the vowel sounds. Next, we're going to do our percussion. So we're basically just percussing for liver span. Okay. Hyperresonance of the gastric bubble. Splenic span to see if the spleen's abnormal at all. We're going to check the kidneys while we're back here. Can you just lean forward for me a little bit? So making sure they're where they're supposed to be. Checking for CVA, there's no tenderness back here. Once we're done with our percussion, we're going to go into light palpation. So we go around the abdomen, just push around, you tell me if anything hurts, okay? Okay, and then we move on to deep percussion, deep palpation from there. Same thing, tell me if anything hurts. And then we move on to like any special tests we wanted to do, like if we were suspicious of peritonitis or appendicitis, we would do rousings or rebound tenderness or something like that at that point. Okay, now we're going to move on to the feet and legs. So we're going to inspect the skin for any abnormal characteristics. We're looking at muscle tone, symmetry. We're going to look at the skin and nails and the hair distribution to see if there's anything abnormal there. Everything looks good, no discoloration, no swelling. So then we're going to palpate. So we just go from top to bottom. We're palpating for temperature, any pain, any abnormal texture. We're looking to see if we see any swelling in the legs, any edema. If there were edema, we check for pitting edema. We're going to do our pulses here. I'm just going to kind of have you bring the leg out for perpendicular. So we're basically going to look for our different pulses here. So the dorsalis pedis. We're going the back one, and then the popliteal. Alright. So the pulses are normal. So now we're going to, while we're down here, we're going to check range of motion and muscle strength. So essentially I'm going to have you move your legs for me. Alright, so can you just push your hips out to the sides laterally? And then in. No, in. Okay. Now I want you to kick out. Okay. Don't push out. Alright, pull in. Go in. There you go. Alright, so push down on my foot like the gas pedal. Okay. Now I'll push up. Okay. So muscle strength's good. Range of motion, can you just stand up for me a little bit? There you go. Alright, so I want you just to bring your hip out like this. Okay, bring it back in. Other leg, yep. And then same thing, just kick out, curl. We can do it, it's hard. I just want to examine it like so we can see it. Normally you'd be on the exam table for this, but it's fine. Okay. And then we're also going to check the hips while we're here. So we're going to palpate for stability. We've already done the muscle strength test and the range of motion of the hip, but we typically would have you land on the table. And the same thing, I'd have you adduct, extend, and flex the hip. But we're not going to do that for time. So musculoskeletal. So essentially I'm going to have you change position here. So I want you to essentially, you'd be lying down on the exam table, and then I would have you move to a sitting position. So I'm just observing you do that to see if there's any abnormalities in your posture or gait, anything abnormal that I note. We're looking for coordination, use of muscles, how you move around, if there's any abnormalities in movement or anything like that. I'm going to inspect, can you stand up for me one more time? And just bend over at the waist. I'm going to stand behind you, and I'm going to inspect your spine for any abnormalities in alignment, okay? So can you just bend over at the waist for me? So your spine is aligned, the posture looks good. So I'm also going to have do the range of motion of your different spine now. So I want you to kind of hyperextend like this. Bend over and touch your toes. It's going to bend over and touch your toes. Okay. Can you do a lateral bend like this for me? Side bend. Other side. And then trunk rotation like this. Okay. There you go. All right, you're good. You can have a seat. And we're also looking at the symmetry of your shoulders, all the muscles of the back. We already looked at the scapula before, but we're just going to do that again, make sure everything looks good back here. Everything looks normal. The last part we have to do is the neurologic exam. So I'm just going to use my little book here to make sure we didn't miss anything with all of that. I think we already checked. Oh, you know what we did miss? When we did the optic exam, we did not do the near vision test. So I'm going to have you, I know you typically wear glasses, but just, so we get 6 feet apart here. Tell me, can you read the,
E.
No, read the smallest line you can read, essentially.
E, C, T, P, L, and L.
C, T, okay, good. Very good. All right, so that's what we're basically evaluating the cranial nerve number 2 for that one. So let's go with that. Now we're going to get into our neurological exam. So we already did strength and sensation. I'm going to test your reflexes now. So I would have a reflex hammer. So I'm going to start by doing the tricep. So basically just hang your arm for me. I'm going to tap and look for the response there. We're looking for +2, that's normal. We're also going to do the brachial here, and then the forearm, and we're going to do the same thing bilaterally. In the lower extremities, we're checking the patellar reflex there, and the Achilles, so back here. And then we would do the plantar reflex as well, or the Binsky's, where we run along the bottom of the foot. Okay, so that is our reflexes. For cerebellum, can you do me a favor and cross your legs for me? And then alternate rapidly as fast as you can. Then run your shin down your heel down your shin for me. Okay, other side. I want you to put your hands on your knees, flip them over. No, okay, fast as you can. Okay, so alternating hand movements. We're also going to do graphesthesia over here. So I'm going to draw, don't look at it, I'm going to draw a pattern in your hand. Can you tell me what it is? What does it feel like?
An apple.
No, it's a simple pattern. It's a number.
Number 8?
Number 8, okay. I'm going to give you an object. Close your eyes for me. I'm going to put it in your hand. Can you tell me what it is?
A pen.
Yep. So that's testing stereognosis. Okay. We're also going to test sensation. So we're doing temperature all the way down. We already did the face, but we're going to do it again. Check the upper extremities, which we've done for sensation. Tell me, you feel this all the way down. Okay. We're going to do 2-point discrimination. So I don't have the tool, but essentially I would touch your skin with a sharp point and a dull point and ask you if you can tell the difference. So we do the same thing all the way down each extremity bilaterally. For that, we also can do vibratory sensation with a tuning fork, and we're going to test your skin temperature all the way down bilaterally as we go down, just to make sure you're not cold or anything like that. Okay. Can you stand up for me? Stand on one foot. Okay, hop up and down. Be careful, don't fall. Alright, so other side. Okay, alright, so I want you to close your eyes, put your hands out like this. Okay, you feel like you're gonna fall over at all? How's your balance? Everything good?
Yes.
Alright, so take your finger to your nose for me. Okay, then to my finger. Alright, fast. Okay, other hand. Okay, that's good there. So I'm gonna have you walk essentially to the fireplace there and then walk back to me, okay? So I'm just evaluating the gait right now to make sure there's no abnormalities in gait. So come on back. Okay. Can you do heel to toe walking this time for me? Just come a short distance, you don't have to go far. Okay. Then I want you to walk on your tiptoes and your heels each time. Okay. And that is about it, I think. I think that concludes our physical exam for today. Thank you very much for letting me examine you. Do you have any questions or anything you need clarified on that we did?
No, thank you.
All right. Thanks a lot. I appreciate your time.